Okay. Well, good afternoon, everyone. It's a pleasure to be here and chat with you about the Canadian Index of Wellbeing. What I thought I would do today, and I apologize if many of you are already quite familiar with what we do. If you're not, you're going to get the backstory, essentially, of what the index is, how it developed, where we have taken it up to the release of our first and second national reports and some of the other work we're doing. And then for the benefit of this particular seminar, I'm going to give you some basic results from our disaggregation of our data down to older adults and just speak briefly about that. It's really some preliminary stuff from a research project that we have a fellow at the university working on right now. But I'm also going to tell you about a couple of other initiatives we have underway as well that have the potential to better inform our understanding about well-being across the life course, but with a particular focus on people over the age of 65, just as for exemplary purposes. So, the Honorable Roy Romano and Honorable Monique Bejean are the co-chairs of our advisory board and have been since the beginning. And actually the CIW got started back at probably around the year 2000, maybe even 1999, at the Atkinson Charitable Foundation. And their board, if you know about the foundation, they're very much committed to social justice. And they want to improve lives of Canadians in a variety of ways, particularly within Ontario. But someone on their board one day simply asked the question, what would it take to actually measure the well-being of Canadians? And that question came up because of a dissatisfaction with GDP being the predominant indicator that is often used to assess progress in society. Now, both Roy and Monique, as you probably know, were very instrumental in the Royal Commission several years ago with respect to healthcare in the country, and Roy in particular was very adamant about celebrating these values and talking about how central they are in guiding the course forward, and also looking at beyond the healthcare system to the kinds of things we do in our communities as individuals, other areas of policy that could actually enhance our well-being. So that really planted the seeds for this project to get underway. And Atkinson, to their credit, committed a considerable amount of money to make all this happen. So the development of the index itself took 10 years. And I'm going to tell you a little bit about how that came about, just to give you a sense of why it took that long. What I'd like to do first is just sort of give you an overview of what we're trying to do at the CIW at the University of Waterloo. And these 3 bullet points here about our mission really sort of capture 2 of our pillars that we try to reinforce within our project. The first is to conduct rigorous research, because if we're going to measure well-being, we're going to assess its impact and the things that influence it. We want it to be based on really solid evidence and really sound, rigorous academic research. So that certainly is one of the key pillars to generate the kind of information we need in order to inform the second pillar, which is knowledge mobilization. And I say knowledge mobilization specifically because we're not interested in just translating and transferring and exchanging knowledge with people in communities, with policymakers and so forth. We want to see that evidence actually make real change in communities. And some of the things that I'll tell you about a little later, I think we've begun to actually realize that as well. So these are the kinds of things we really want to see happen with the project. So how do we measure well-being? GDP is popularly used and reported in the media, and unfortunately it tends to get strays over into saying this is how well we're doing as a society as well. But GDP only measures economic productivity. And it misses a lot of the important things that people actually do, like volunteering and unpaid work at home, all the sorts of things that aren't economic drivers of the economy, but certainly have an impact on the economy and are influenced by it. So it is very much flawed in that regard. And in fact, that's been known for some time because, as far back as 1968, Bobby Kennedy, famously, said this at a speech, I think it was at Kansas State University, and he was decrying the limitations of GDP as a measure of progress and talked about some of the things it doesn't measure, but some of the things it does include that are terribly misleading about how we're progressing as a society. For example, in 2005, GDP took a huge spike in the United States because of Katrina. And so much money was invested in the rebuilding and restructuring and so forth in New Orleans area, GDP went up. But very few people would suggest that that was a good thing for the well-being of the people affected, but for the American psyche overall. So we really wanted to abandon that as a measure of social progress. But I think it's important to note, too, that we're not looking to replace GDP. We simply want to complement. There is an effective and useful measure for economic productivity. What would be a complement to the social progress of our country, of our communities, of our individuals? So as we set out on this, we wanted to ensure that people understood that when we talk about well-being, we're talking about more than just health, the physical health and mental health of people, but all of those aspects of their lives that actually affect their well-being. So it could be emotional, spiritual, social, and so forth, as well as those others. And that often brings to mind the World Health Organization definition, often cited, little used in practice, I would argue. So one of the important things, too, is that we wanted to go beyond health and talk about those things and factors that actually affected people's lives. This quote, some of you may have heard, I think it's attributable to me, Beijing. What good does it do to treat people's illnesses and then simply send them back to the conditions that made them sick in the first place? Now, that's very much a social determinants of health type model. And, I would argue that that's essentially the approach that we're taking in the development of the index of well-being for Canada as well. So, how did it actually come about? I'm going to give you a bit of background on the index to show how the thing came together and in part why it took so long to actually come to the index and the report that we released this past year. So here in a nutshell is how it came about. Back in the early 2000s, the Canadian Policy Research Network was enlisted by Atkinson to help with public consultations around the country, to consult with experts and academics and so forth, as well as government leaders and policymakers. But for me, the critical piece was the community organizations, the special interest groups, and citizens themselves. And essentially what their researchers did is ran focus groups all across the country with Canadians in all different parts of our geography, coming from all walks of life. And those focus groups were organized around a simple question. What matters to you? What makes your life good? And essentially what they did was to pull all that information together and look for some threads that seemed to be common from the perspectives of all Canadians. That was also informed, as I say, by experts, an environmental scan internationally to see what others were doing. Probably famous example is Bhutan has the gross happiness index, I think they call it, and they actually don't use GDP to assess the progress of their country. And those are the kinds of things that we started to see over and over again in these focus groups, in these consultations, where certain themes began to emerge. Now, as they began to emerge, research teams were enlisted by the Atkinson Foundation to really dig into the literature and say, what are the specific factors that seem to either contribute to or detract from our well-being? Like, no matter what it is, tell us what it is. Now, they were focused in a particular area. The big reveal's coming in a minute. But essentially, they wanted to find things that were consistently and validly related to well-being. And I'll give you some example on how difficult that process was, because there's a fair amount of debate around certain things that are either good or bad for us. And we wanted things that we could fairly accurately say the evidence is overwhelming that this does contribute or detract from our well-being, if we're going to come up with good indicators. So at the research team level, which happened in the mid to late 2000s, those domain reports, if you will, reviewed the literature, identified indicators, and made recommendations on these are the things that we should measure if we're going to come up with a really good measure of well-being that captures all those things that matter to everyday Canadians. Now, that had to be traded off against what kind of data do we actually have available. There's lots of national surveys and so forth that are done, but they needed to be reliable and that we could track things over time to see if things were going up or down. They had to be measured consistently. We couldn't be comparing apples and oranges if they changed the focus of a question or what have you. So the compromises that were made in finding the actual data to support the indicators we wanted was a real challenge, and it continues actually to this day. The sum of that process then was to identify indicators within each domain to actually measure well-being. So here are the kinds of things that thematically consistently showed up through those consultations. good living standards. Now we talk about that, we're not talking about the economy, we're talking about income gap, we're talking about the match of job skills to job quality, we're talking about housing affordability. You know, so the kinds of things that on the ground actually affect people with respect to the economy. I don't think there's too many people that are on long-term unemployment that see the quarterly reports of GDP and think, oh, I'm much better off now. Robust health, vital communities, the extent to which people actually feel they belong to a community, they're connected with it, they volunteer, they feel safe in their neighborhoods. Education, sustainable environment, time use in terms of the work-life balance, time spent with family and friends, levels of democratic participation, the extent to which people are actually engaged in the democratic process, and access to and participation in leisure and culture. And that's actually the area that I came on board because I wrote the domain report for leisure and culture. As a professor of leisure studies at the University of Waterloo, it was very close to my heart, so that's how I became involved in the project originally. So those ended up defining the 8 domains that constitute the Canadian Index of Wellbeing. So those are the domains, as I mentioned, that the research teams actually did their focused research on. So for example, in leisure and culture, I looked at all the literature that we have about the role that leisure and recreation, arts and culture, sport, and so forth contributes to higher levels of well-being. And not just physical, right? There's a lot of evidence in the media right now talking about the importance of physical activity. Let's try to reduce obesity by getting our kids more active and so forth. It extends way beyond that to our social, emotional, psychological, well-being as well as spiritual and so forth, in different realms, both in terms of our participation, how much we experience it, our perceptions of that free time and so forth. So those are the kinds of things that people struggled with to come up with indicators and then try to find data that would actually inform those things. So when we actually went to build the Canadian Index of Wellbeing, here's what we ended up doing. We wanted surveys and databases from 1994 forward. We used 1994 as a base year because a number of initiatives with Statistics Canada, which we rely on extensively for a lot of the data, began that year with the National Population Health Survey, for example, and we've got some data that we can track forward from that year. Overall, in tracking all of these indicators forward, we use, it's actually up now to about 130 unique data sets that we draw from for the indicators to inform the index itself. As I say, the principal sources are Statistics Canada and Environment Canada. That's where we get much of our data. We also get it from like the World Wildlife Fund. Well, anyway, a few other sources. I'm sort of at a loss for all of them. The Stats Canada, we rely on quite a bit. Not so much on the census, surprisingly. A lot of people ask us that and say, how much are you worried about that? Well, right now we only have one indicator we take from the census, and we can get that from one of the other surveys, like the labor force survey anyway. Now, the data that we gather, some of them have to be interpolated because, for example, the General Social Survey is done every year, but it focuses on different themes. And so, for example, for time use, it uses several indicators from the time use survey, the General Social Survey, but it's only collected once every 5 years. So we use a fairly simple algorithm to estimate the values of those points in the intervening years in order to track forward. For something like living standards, which comes principally from the survey of labor and income dynamics, I think it's called, labor force survey, they've got data like every week, it seems, right? So they can fill in every one of those points. So from 1994 to 2010, 8 domains, there's 8 indicators within each domain, so a total of 64 in total. So 64 indicators across 17 years is all the data points that we use in order to track the index forward. So here's an example, leisure and culture, of one of those domains and the types of indicators that we collect. So for someone whose whole area is this, I see this as inadequate because it doesn't capture everything that I think it really should to get at leisure and arts and culture and so forth. But you can see there's a broad array of things here that tap into the kinds of things that people do during their free time. Time spent with other social leisure activities, physical activities, time spent in arts and culture, the extent to which people volunteer for arts, culture, and sport organizations, which is a nice one, because volunteering is not only something people do during their leisure time that satisfies themselves, through some sort of altruistic giving back, but the communities themselves benefit from those volunteers providing services and support to those organizations within their community. attendance at arts and culture, performing arts performances, visitation to national parks and national historic sites. That captures the notion of how important the natural environment is in supporting our outdoor pursuits. So whether or not you go there, there's a vicarious enjoyment knowing that those parks are there. Nights away on average on vacation trips, and expenditures in the past year as a percentage of total household expenditures that are dedicated to recreation, arts, culture, and so forth. So these indicators are measured for each of the years the data are available, tracked forward over time, and then consolidated into a domain index for leisure and culture. And then that domain index is combined with the other 7 to come up with the CIW, the index of well-being for all of Canada. Now, I'll speak to some of these things and answer some questions you have about. There's all sorts of challenges, I say, with doing this. We've tried to keep it relatively simple. Most of the data we get, most people can get themselves, so if they want to replicate what we're doing, so we're not just doing a magic ball thing here, are available in the public domain, so people could actually capture these things. One of the questions I often get as well is, do you weight the indicators? And we don't. And part of the reason we don't, it was a conscious decision, is that there's not really a universal weighting system that everyone will agree on. So for example, you might value the environment more than I do. You might value community connections more so than living standards. So there's always debates around that. And someone suggested that maybe we could weight it based on some of the values surveys that are done, what people actually collectively ascribe to it. And we did think about that, but my concern is that's kind of a rear view mirror perspective. That's what people are telling us have been important to them, that they do value. And if we're looking towards, visioning a better future for all Canadians, do we lose something by only celebrating and valuing the things that are important today? So we keep it simple, and we don't bias it with weighting systems that might not be as universally held. So, yes?
Does the government use this for funding?
No. We don't get any government funding.
Which is too bad, actually.
Well, it's interesting because there's a number of other initiatives around the world, and one of the things that is sort of paradoxical is most of them are government-led and government-funded. Mm-hmm. And when they talk to us about where we are, we tell them we're citizen-led largely and don't get government funding. Mm-hmm. We have cooperation from like Statistics Canada, but no funding. And so basically, we're nonpartisan. We're not, pushing any particular, political agenda.
No, I agree with that. But does the government look at this and say, oh, this is a priority now, should we fund this? Do they look at your stats or do?
Yes and no. Yes.
Yeah. Okay. Details.
We have a number of federal politicians and provincial MPPs and MLAs from around the country who follow us and seek information from us when they want to probably stand up in their legislatures and make a point. Is it informing policy change? Probably not at this point. Okay. We quite happily saw that, the Green Party actually has us as part of their platform. And Elizabeth May got up on the last day of the House sitting in the summer in June and actually introduced a bill on measuring the well-being of Canadians as a way of informing government policy. And of course it died there. But there is some recognition.
You are funded through the university.
Only in kind.
Yeah.
I mean, right now we've got transitional funding from Atkinson when we moved to the university. But we're trying to find funding to support us right now, actually. We've got, some pokers in the fire that seem to be heating up a little bit, but nothing yet. I mean, I've only got 2 staff people working with me right now, and, they could be gone in July, which is not a good thing. Anyway, this graphic that came out got the most notoriety, and so we operate, in a sense, at 3 levels. The overall index, which is reflected here, indices for each of the domains, we can speak to particular contexts, but also each of the indicators as well, which are probably the most actionable things that people can respond to and say, we need to do something about that. And that's very often where we see the impact of change occurring. But this is a great conversation starter. We got a big 2-page spread in the Globe and Mail with this, and they talked about the domains and so forth. When we released this in October of 2012, some friends of ours in Winnipeg They use one of these online tracking media things. And over 30 days after our release, we had over 34 million unique hits on over 400 stories. And they told us that that would have been about $1.5 million in advertising. Now, how long-lived is this? We obviously want to keep releasing this as we have new data to track things over time. But as I say, it's a great conversation starter. It garnered a lot of attention. It got us a lot of connections developed with different sectors across the country, particularly in Ontario, and a lot of communities who said, how can we do this in our community to make real change? And so that's actually where our project is heading now. So this one, was particularly effective in doing that. And essentially the story here is, I should have mentioned that the indicators, because we measure all sorts of different things, how do you standardize them? With the 1994 bench here, we set every value of every indicator to 100 and then calculated percentage change with each year as a new data point became available. So now we did have something that we could aggregate in a sort of standardized way, if you will. So this represents the percentage change in GDP per capita since 94 and in our index, and you can see the significant gap there. Even in the early years when the economy was doing really well, our well-being, at least as how we're measuring it, was largely ignored and fell further and further behind. The other troubling indicator here is that with the recession in 2008, we see a dip in GDP. It's beginning to recover. Our well-being isn't. And that's part of the problem with having a laser beam focus on the economy, and it's all about jobs. And I'm not suggesting that's not important, but there needs to be other voices around the table to ensure that the other things that matter to Canadians, that they've told us matter to us, are represented in those government policy decisions as well. And corporate decisions as well in terms of employee productivity and all the rest of it too. You recognize that some domains will do better than others, so here are the domain indices, and we can see that education and living standards up to the recession was doing reasonably well, as was community vitality, to some extent democratic engagement, but obviously there's concerns about health of the population, time use, people are feeling more time stressed, time crunched, but in particular their leisure and culture and our environment. The environment's an interesting one because there's a lot of debate how that one should come together, because we didn't want to be seen and dismissed as just another strident voice saying the environment's going to hell because of all the damage we're doing to it. The indicators in it are a balance between those things in the environment that actually contribute to our well-being. We're resource rich as a country. That does us a lot of good. But we also have the balancing consequences of our impact on the environment in there. What makes this interesting then is that even with that balance, we've seen the deterioration of the environmental well-being domain in spite of celebrating some of those resources that are available to us as well. So over that 17-year period, a 5.7% growth overall, but the green areas are areas that we've seen some growth, certainly not as much as GDP, and the red arrows down the domains that apparently have shown negative growth are actually in decline, which is terribly troubling. When we take a look at the indicator level, we can now begin to see, which of the indicators within a domain are actually doing better than others. I mean, for physical activity, for example, the spike in the mid-90s, some have attributed it to the resurrection of participation, growing media awareness about inactivity amongst children and so forth, and a general sensibility that maybe people should be somewhat more active. Vacation nights is up there as well, but you can see the time people spend in social activities has steadily declined over time. And some have attributed this to the cocooning phenomenon, where people are hunkering down in their homes and watching Netflix, making connections through social media as opposed to in person, which is what this measures, and wondering whether or not that is a bit of a problem. And that's a good example too, where there's some debate now. This one was clear from all the research, but now there's more research about whether or not social media actually does contribute to creating connections that are sustainable and as sincere as the face-to-face ones we've tried to maintain in the past. So we may have to revisit that. Culture and recreation and volunteering is rebounding, but most volunteers tend to be older adults. As they drop out, middle-aged are not replacing. It's starting to go back up now as the baby boomers enter retirement and looking for ways that they can give back. Parks Canada actually contacted us about the national park visitation because they've seen a steep decline. And we're wondering, about some of the things that we saw in our data that might help inform their policy in that as well. So again, green arrows up. We've seen some positive change in those indicators, but in the leisure and culture one, as I say, a lot of negative indicators. I'm gonna start speeding up a little bit here so we can get to the older adult stuff. Here's indicators for healthy population. One of the things I should point out is that the green line going up doesn't mean teen smoking is going up. It means that because we've seen a steady decline in teen smoking, that's good for our well-being. So that's a positive change. And similarly, red going down is bad for us. So we've got both negative and positive indicators in there. Teen smoking is a bad thing, but because we've seen declines, it's actually good for our overall well-being. Increase in diabetes, especially amongst First Nations people, is probably the greatest concern here. The flu shot one is interesting. The Chief Medical Officer of Ontario contacted us about that because they were concerned that they'd seen declines as well in the overall. So we did separate those things out. And if you can think about the ads that are running, who do they target? Older adults and children. And when we disaggregated the data, we were able to show that those groups are maintaining their commitment to getting the flu shot every year. It's the middle age, like the 20s to the late 50s, are starting to tank. Well, it doesn't affect me, so I guess I don't need to get it. So it changed the way that they're focusing that, and I'm not taking credit for this. They didn't even cite us in the report, but anyway. But if you've seen the recent ads, now they say, if you're older or a kid, you really need to get this, but everybody needs to get it, right? So that little addendum's been added to their message.
Which is the graph for flu shot? I'm sorry to interrupt.
Sure.
The back arrow down on the keyboard.
Oops.
I just couldn't find it. Sorry about that.
Yeah, I stuck it up here.
Oh, I see. Oh, health.
Yeah, I stacked them in the same way that the lines are
Health
stacked.
Services rating is flu
Yeah.
shot as well.
Yeah.
I see.
Okay.
Thank you.
So again, we see a mix of some positive indicators, and this is, as I mentioned, teen smoking, 85% decline actually, which is actually good for our overall well-being. So let's move into now older adults. And why do we want to look at older adults? And I've made this fairly straightforward. Obviously later in life is an important transitional period, both physically, socially, and so forth. There's a lot of policies that concern quality of life, but they tend to focus on youth and adolescence for the most part. And they also tend to be, associated with sort of negative consequences of getting older, as opposed to celebrating the assets of getting older as well. So we wanted to start maybe challenging some of those assumptions and looking at this group as a whole, how they compare relative to the rest of the Canadian population. I'm also going to give you a little bit based on province, because the province is very often responsible for many of the policies that could have some impact on different social groups, right? It's not necessarily the feds, it's the provinces that may have mandate over particular social areas as well. So what we did is we simply disaggregated the data that we could by age to see how older adults compared to Canadians overall. So I'm just going to give you a flavor of some of the things we have at the indicator level so you can see. Now, not surprisingly, when people are reporting their self-reported health overall as either excellent or very good, older adults were reporting somewhat lower than Canadians overall, about 38, 39%. Up to about 44% over time. It's significant, although it's marginal. You can see that the gap is beginning to close. Now that could be as much in part because the Canadian population is reporting less often very good or excellent health. But at least the gap is closing to some extent as we enter later life healthier and happier by and large. When we break that down by different age groups, we can see that the 35 to 54-year-olds are the ones that on average are a bit higher. And of course, 75 and older. So this general pattern is probably not that surprising, but you can see that the pattern overall is consistent across all of these age cohorts. There isn't one that is dramatically different. So if we take a look at all Canadians with older adults again, and then break it down by some of the provinces, we should all move to Newfoundland, Labrador, or PEI, because apparently living there, older adults are reporting that their health is somewhat better than other provinces, and maybe being in New Brunswick, Saskatchewan, and perhaps Quebec isn't quite as good. Now, are there policies there in different provinces that may help support older adults transition to later life that we can point to, so provinces can learn from one another. We don't want to get into one of these places rated mentalities where we sort of go, ha ha, New Brunswick, you suck, right? We don't want to do that. What we want to do is we want to say, okay, what's happening in Newfoundland and Labrador that might help us understand how we can better support older adults through their health as they enter their later years. Household expenditures on recreation and culture. This one is interesting because we've seen a dip in recent years as a consequence of the recession, that people are less able to protect that part of their household expenditures for the things that they can do in their free time. But older adults across the country seem to be relatively successful over the years at maintaining and even increasing that proportion. And again, as the baby boomers, one of the more affluent groups, moves into retirement years and so forth, they're better able to do some of these things. And this will show up a little bit later as well. For household expenditures for all groups, you can see that even amongst the oldest old, it's increasing. It's not as great as the others, but those who are in mid-peak career, for example, families and so forth, are taking the hardest hit as a consequence of the recession as well. And again, if we do this by province, we can see that in BC, they're more committed to protecting that despite higher cost of living. And in Quebec and PEI, again, once again, even though a recent spike in that, we do see for older adults generally somewhat less able compared to the rest of the nation. Time spent in social and leisure activities, not surprising. Older adults do this more than most Canadians do overall. We can break it down by age. Again, the patterns are fairly consistent for all groups. 18 to 34-year-olds, the highest, followed by people basically in early retirement years. And those people, again, in mid-career, probably less able to make those types of connections as regularly. So, what are the implications of this? And I've already sort of implied some of these things. Establishing and maintaining active social relationships, just drawing on some of the few things I've given you here. Critical to well-being in later life. It helps us identify factors associated with place and how different provinces can presumably learn from each other on particular aspects of policy. We did something similar to this with younger groups as well. And you may have seen the series that ran in the Globe and Mail a couple of weeks ago on the child care system in Quebec and all of the implications it's had for other aspects of society. And this is a message we have as well, is that we don't want to see these domains as silos or the indicators as being uninfluential on other aspects. You make a change here, it could have implications all across aspects of our well-being. People become engaged in leisure activities and through social networks within their community. They start to feel more engaged in their community. They might volunteer more. By volunteering more, they raise the level of belonging to the community vitality may take, and people who are more connected to their communities are more likely to vote, become part of the democratic process, and so on and so forth. So we see all of these threads interconnecting all these different ideas. And with respect to cost of living, of course, what policies and services are in place to support older adults, particularly those that are having greater difficulty in gaining access to, especially recreation and cultural activities.
Can you just go back to, because I keep looking at Newfoundland and Labrador as being PI, and I keep thinking family involvement. Where in the other provinces, I'm wondering if this healthcare and is more involved with isolation because we have such a high immigration and families aren't as involved.
I wasn't looking for that.
Because there's a huge difference in health when families involved, I think.
Yes.
And taking care of families. Whereas in the other, especially like Toronto, I would think there's more isolation. Your children aren't necessarily near you or whatever it is, okay? But I just keep, because there's got to be a reason. I mean, do you have definitions of what you call, certain things like you're talking about, lifestyle and healthcare? Do you actually define it?
All of these data come from the national data sets. So, when interviews are done and surveys are completed, participants in the surveys are giving definitions. I'm not, pretending to use definitions precisely here. I'm just trying to give you a big snapshot. All of your points are really well taken. And one of the things that we're trying to do through this exercise as well is encourage our colleagues to, to pick up some of these ideas and dig a little deeper to try to find out why we're seeing these differences the way they are.
For sure.
And so, that, to some extent, a student comes in and says, I want to do a thesis on something related to this. That's an idea that could be explored to see the extent to which those kinds of family supports in highly urbanized versus more rural areas might, play
Even
out.
neighbor to neighbor, because they know their neighbors. Right?
Absolutely, yeah.
And as a community, what's their culture? They help each other.
Yeah, and that's part of what I was saying about the interconnections between these, because within the community vitality, one of the questions is about the number of close friends and neighbors you actually identify. So that there's a connectivity there. There's a question about sense of belonging to your community. So there are some things that we can use to say, are these actually tied to patterns we see elsewhere? So I'm not making excuses. I'm just saying right now we're at this sort of big picture level. And these are the kinds of questions that are coming up that are great projects that I think people could really start digging into.
Were you surprised by the PEI and Newfoundland Labrador? I'm not.
No, I'm not either, actually.
Okay.
Yeah, me
So,
neither.
No, okay.
yeah, it's like going to another country. The sensibility on the East Coast is so much different. I have some family down there. I mean, Waterloo, it's like a mid-sized city. I mean, coming to Toronto, it feels fast-paced here, right? It's relaxing to go back to Waterloo. They come to Waterloo and say, I gotta go home. That's crazy up here. So yeah, I think, there's a lot of merit. It seems to be playing out in that respect. I show you this because as a consequence of the work we're doing with the national index and so forth, we've actually been getting a lot of international interest as well. So you can see, I mean, we have some, advisors on our international and our national advisory board that come from all around. But the dots in red are countries that have since been in touch with us, asked for information about how this thing has developed. We've partnered with Australia. We've been invited to Ireland and to the UK to talk to their groups about the development of their projects and so forth. And this is where we begin to understand that, the government-led ones, there's local concerns about, will this simply fuel an ideology represented by the sitting government as opposed to really be directed by. Now, one of the differences is that we don't measure well-being directly. We measure those things, that sort of social determinants of health approach, those things that seem to affect well-being in some meaningful way across all of these domains. In the UK, what they're doing is that they have their national household survey that they run each year. They've added 4 questions on well-being. Are you better off, or is your overall health and well-being better now than it was 5 years ago? How would you describe your life satisfaction on a scale and so forth? They use that as sort of the outcome measure, and then they look at all the other information in their household survey to see what factors seem to be related to higher and lower levels of well-being by subgroups in the population as well as by geographies around the country. Entirely legitimate approach to take. So we're not saying one is better than the other, but it's just a different strategy than the one we're using. The other sort of thing that has occurred as a consequence of doing this is a number of organizations and communities that have reached out to us to say, can we develop an indicator system for our community? And we thought this is great because it's at the community level where a lot of grassroots change is more likely to happen. It's where services for older adults are very often provided, so it seemed like a meaningful thing to do. I'd like to say that, it was at that moment I had one of those intellectual epiphanies that makes me seem really smart. It was really a duh moment, because what we found was that, a lot of the indicators that are available at the community level are simply not available. There aren't enough data at the national level to disaggregate to communities. Lots for some of the CMAs, but not for the smaller communities. And sometimes the indicators didn't translate well to the local level. Visitation to national parks and historic sites, well, you could come up with a local proxy on use of the municipal parks and trail system, for example. But what was happening is some communities had good data, others did not. And our long view is that let's come up with a system that communities, at the same way we're trying to do with the provinces, could make comparisons across communities as well and help each other out in terms of what are you doing that your democratic engagement within your community is doing better than ours, what can we learn from you? So what that led to for us was the development of a community well-being survey. And what we did, and we partnered with the city of Guelph actually initially, because they were the first ones that came to us. And in part because their mayor had run on a platform, was elected on a well-being initiative for the city. And so they're doing all kinds of things, and they're using well-being as the model for their social planning in the community. And they've embraced our framework around the 8 domains as a way of moving forward. So getting in lockstep with that, we designed a survey for community members to report on those aspects and conditions and circumstances of their lives related to all 8 domains, so they could tell us how well they're doing. And then we had an overall measure of well-being as well. So an indicators kind of approach, community-based survey with an overall well-being measure as well, so that we can start to do the kinds of things you asked about, dig a little deeper, find out what factors are interconnected in a meaningful way at a grassroots level. So this is really preliminary. So I've just got a couple of snapshots in here for you. This was a long survey. Some of the questions we drew from national surveys so that communities could say, here's how we're doing here. How does that compare to the national data? We came up with some original questions for them on specific aspects that tied to the domain that the national indicators didn't reflect very well. So for example, in environment, we have measures like ground level ozone, greenhouse gas emissions. You know, if you got our survey, how would you respond to how's the greenhouse gases in your neighborhood this week? You know, good, bad. I mean, how can you report to that? So we shifted the emphasis to the extent to which people are actually stewards of their environment. Do they recycle? Do they reuse? Do they use local food markets? Do they walk or bike or take public transit rather than drive personal cars? What are their feelings about the environment and so forth? So it got at the extent to which they perceived and actually supported environmental care, if you will, as a way of raising well-being, not for just themselves, but also for their communities. So the plan, as I say, for well-being in Guelph used our framework. We ran the survey in the community across households, randomly selected across the entire community, so we've got good representation all over. So we could compare neighborhoods, and they wanted to see how their wards compared and so forth. And we provided them with some basic information and have been continuing to work with them. We've also done this in Kingston now, in the Waterloo region. We're going to be in Victoria next year. We're going to be in the Wood Buffalo region, Fort McMurray, but also in some small communities like Temiskaming, Burns Lake out in BC, which have, I think, 3,500 people. Anyway, so it's really catching on. So just to give you an idea, here's the 6 wards in the city of Guelph. And from a purely demographic standpoint, we can see where there's higher proportions or lower proportions of older adults living in the city. So bold red, lower than the overall average for the city. Bold green, higher. So you can see wards 6 and 4 are the ones that have lower proportions of people over 65. Wards 2 and 5, higher. Right in here is sort of where the CBD, the center of the city actually is, right in the middle of Ward 5. Sense of belonging by age. So in other words, people indicated the extent to which they agreed they had a strong sense of belonging to their community, separated by age. You can see that for older adults, much higher percentage are saying strongly or very strongly agree, connected to this community. Now, one of the things that may come immediately to mind is how long-term residents are they? How deep is their footprint already within the community? That's certainly something we can look at, but the pattern certainly does seem to be fairly consistent. Participation in physical activity. This sort of belies some of the things that is often reported. Certainly team sports and individual sports, less participation. Physical activity, which tends to be a fairly vigorous type of activity as opposed to just general exercise like walking, light exercise at home or what have you. You see that people over 65 are generally committed to doing that. That proportional differences is probably attributable to some later life challenges that some in the survey may have faced and so forth. But it does put to some extent that as soon as you hit 65, you sit in front of the TV. We've got TV measuring here as well, and it does belie that. Arts and culture activity. The only area that older adults appear to be significantly below is in terms of some of the local festivals, but their greater adherence to live theater certainly as much in going to musical concerts and so on and so forth as well. Inability to pay for things at least once in the past year. So in other words, did you not have enough money to get the things you wanted, the things you need, you couldn't pay your bills on time, or you ate less because you just didn't have enough money? And this pattern here is striking in that those people over 65 are reporting much less or much more often that they didn't have enough money to pay for things they either wanted, they needed, couldn't pay bills on time, or ate less. Which is striking in from the standpoint of perhaps fixed income. Baby boomers going in, that there's reports that are presumably somewhat more affluent. So one of the the things that is of concern here is how do we dig down a little bit deeper to see what the circumstances are, the conditions within which they're living, and so forth. Now remember that these are people who are still living in their own homes in the community who have responded to this survey.
So you wouldn't have had all the students in Guelph?
Actually, we did have some, but they were generally underrepresented in the survey. It was more the permanent residents, as opposed to, say, we did get into renting facilities and that, but I think because of the tone of the survey being about the residents of Guelph, they probably were underreported because, well, this is where I only go to school. I don't actually live here. So, they are underrepresented in that respect. Physical health, not as bad as popularly reported. Certainly it's somewhat below in terms of reporting very good or excellent. But mental health, higher than the general population within the city as well. Now here's how we measured overall well-being, is on a variety of aspects, and you can see how all of these indicators tie to specific aspects of our domain. So things like neighborhood as a place to live is tied to community vitality. Access to recreational parks opportunities tied to leisure and culture. And you can see that there's a lot of those types of things pertaining to each of the domains. So people simply indicated the extent to which they were satisfied with these and aggregated together as a measure of overall well-being. This is what it was for the overall community. 5.24 for those people 65 and older. So generally speaking, and this is fairly consistent with national and international surveys, people in later life are generally more at ease with their overall well-being in later life, and that certainly played out within Guelph as well. So that, it's very preliminary. We're just getting started and digging into these data. As I mentioned already, higher levels of overall well-being amongst older adults. They're not as different from the rest of the population as might have been popularly perceived in certain areas like community belonging and so forth, and are perhaps better in some other areas. Managing finances shouldn't be there, but mental health, certainly, and engagement in sort of light exercise and so forth in order to maintain physical health is certainly there as well. And some of the things that I didn't report here, but we did take a look at, was there's some questions in terms of access to healthcare services, access to parks and recreation, and so forth. And it does appear that where older adults do feel somewhat more disadvantaged, it's largely due to perceived less access to the types of services that they may draw on to raise their levels of well-being. So there's a policy implication, arising out of this survey. One of the things that Guelph is doing is that when they got the survey and through a number of other initiatives that they're running, they put together what they call design teams. And they got residents of the community to actually volunteer to sit on committees with the city to make recommendations on how they could enhance well-being for the community overall. And I remember the project manager contacted me about a month or two ago and said, we can't keep these people on message. They keep straying into other domains. And I was like, well, that's perfect, because it gets back to the point that they're beginning to recognize that even though they volunteered, say, for community vitality, they're talking about things that are related to how we can support people's living standards, how we can improve access to parks and recreation. So they implicitly understood the interconnections between the area they were charged with and how changes there would manifest perhaps elsewhere. So one change in one area could have trickle-down effects, or crossover effects to other domains. And we're really excited about that. We've already begun talking to them about redoing the survey in about 3 to 5 years after they've been making some changes to the way they deliver services and so forth, to see whether or not they've been able to shift the dial. You know, so now they're looking at it as you know, a way of assessing impact of changes to policy and practice as a way of enhancing well-being within the community. And Kingston's talking about doing the same thing as well. That, again, was an argument we made about trying to standardize the survey across communities when they applied it, so that it could not only compare to one another, they could compare forward as well, you know, once they reinstituted the survey. So we got a lot of stuff going on right now. We'd love more researchers to help us out with, you know, some of these you know, questions and so forth. But you know, I think I'll leave it there and answer any of the other questions you want to have about our project. So thank you.
May I commend you on your continuing efforts, and I apologize for being late. Maybe you've already covered it. Is your background in the social sciences or in mathematics and statistics?
Well, it's funny you ask. It's actually in social sciences. My undergraduate and master's degree are actually in leisure studies from Waterloo. My PhD's in geography. The teaching I do now, advanced statistics. And I was never trained in it, right? So it probably is a good thing, I suppose. But no, it's one of the really exciting and challenging things about this project is that it really does stretch me as an academic, because I don't pretend to be an expert in all of these areas. I rely on the advice of my colleagues who know more about the environment, but know more about political science for the democratic engagement piece and so forth. But you know, one of the things that's tremendously satisfying is that I think, you know, we can be accused of siloing ourselves as researchers in university, because we do focus in on, you know, not an unimportant aspect, but, you know, really trying to understand sort of individual pieces of the puzzle. You know, and this is trying to put the whole puzzle together. And, you know, recognizing now the implications of what I do in, you know, my regular job, and how it actually plays out in so many other areas in people's lives, in communities, society overall, is really exciting personally for me. But it's also, you know, rewarding from the standpoint of, you know, this is the kind of interdisciplinary, transdisciplinary approach that really does have, I think, the possibility of creating change, because it gets away from that siloed approach and talks about broader social issues as opposed to this one thing.
My last question is, your two associates, are they postgraduate students, undergraduate students, so that they will continue on to spread the word?
I have an associate director who helps me with the research side of things, and she's a relatively recent PhD, and she helps out in the time use area, the family area, the living standards area as well, so she's got expertise there. The other person who works with me has an undergraduate degree, but she's largely sort of our operations person. She handles all the sort of media communications, helps us get our reports out, and tries to protect me from the inquiries that we get, but not so successful. You know, it's flattering when people call, you know, and say that they want to work with us, but apart from some graduate students that we hire as research assistants, that's the whole shooting match right now. So we really do need bigger capacity. So if you want to write a check for like $25 million, I'd be happy to accept it. So.
Thank you.
I have a really, if we could go back even to you have that graph, and you have, for example, 5.74 at the end. What does that mean?
That was on a 7-point scale of satisfaction with all of those aspects of well-being.
Okay.
So from 1 to 7, older
Okay.
adults were reporting about 5.7 on that scale. That's an aggregated score.
Okay.
So it's overall, on average, older adults 65 and over are reporting higher levels of satisfaction with their overall well-being
I just
than the
needed to know
residents.
what it was on.
Yeah.
The other part I find just in the research that I've done is the formation of the questions. So if you have somebody, and I think this is brilliant, because somebody could come to you and say, okay, this is what we would want to know, but how do we develop the questions? Because you don't know how to develop the questions. And what do we really need to ask in order to get the information? And I think that's where I really wish some research projects would go. How do we develop the questions? How do you do that? you know?
Yeah, much of my work in the past has been on survey development, design, and scale development. And that. So, you know, I understand implicitly what you're saying in terms of how important it is to structure these. One of the things we really resisted in the early days as well is making this an evaluation survey. We didn't want cities to sort of say, okay, we want some questions in here where people say, how satisfied are you with the skating rinks, with the bus service, with, you know, the things that they could see links to well-being. We said, no, they have to be more broadly based on that, and the challenge is going to be for you to see the implications of that for the things that you do. Like a good example is that we didn't want to put in, you know, specific questions about the health centers, the hospitals, or what have you. But we used some national survey questions from the Canadian Community Health Survey, and we asked two things. Basically, you know, ask people to rate the quality of healthcare services within the community, just generally, and ask them also to rate the accessibility of those services. And when we showed the results to the city, the health promotion people in the room, you could almost hear their jaws hit the ground because, I mean, what's the popular discourse in the media right now? Is that healthcare service quality is going down the pipe, right? I mean, lack of funding, lack of all, you know. What we saw in the Guelph example is that the residents actually rated the quality of healthcare really quite highly, but they rated its accessibility considerably lower. So it changed the messaging for health promotion people in the city of Guelph. It's no longer going out there and trying to convince you, no, really, the healthcare system is okay. We still deliver quality services. That's not what people were concerned about. They're sort of going, yeah, I know that. How do I get access to them? Navigating the system, not just physical access, but finding their way through the system to get the services they needed. And we've seen this in other projects that we've done in the past as well. You know, that it's the navigatability of the system, which is the big challenge, not the quality of services. So it's changed the way that they're going to try to respond within the community in delivering healthcare. Not be so narrowly focused on its quality, because people seem to like it. How do we make it more accessible?
Being involved with the military, I'm glad you're going to Kingston, especially in the light of 4 suicides very recently. Are you any plans for looking at the military as to what's going on, say up in the Vimy area versus the downtown core of Kingston?
We don't have any specific plans. We've been asked that question before. You know, one of the challenges with the national data we use is that it's a great random sample of everyday Canadians from all walks of life, except those living on First Nation reserve areas and First Nation communities, those living on military bases, right? So they're not part of those national surveys. So one of the questions that's come up is that how can we get access to groups of particular interest that may have slipped through the cracks? So yeah, again, if we had the capacity, it's certainly a group we're interested in exploring. Yes?
2 questions. One, can one access your charts?
Yes.
Okay. Second one, I'm saying this is great, but,
Yep.
and the but for me is the issue of the reversal of the drop in poverty, going back up, which the government ignores. Immigrant communities. I know darn well where there are areas of immigrant communities where the well-being's lousy.
Right.
How is that reflected in this index? It seems to me it potentially can give us a better picture than the reality in some communities, especially with high immigrant populations, recent immigrant population. I don't have to spell it out.
No,
it's that but that's bothering me.
No, you're absolutely right. At the national level with the indicators, we are constrained by how far we can dig into the data. You know, we're currently putting together provincial breakdowns. And even trying to disaggregate all the indicators to the provincial level, we can't do it with them all because the data just simply are not disaggregatable to that level. So when you introduce and say, can you subdivide the data based on particular groups of interest, it starts getting pretty thin in particular areas. So for example, I mean, even so these surveys might, have 30, 40,000 respondents. If you want to know about a particular group of ethnic origin living in the city of Toronto, all of a sudden you've got a handful of people, because you slice the data down. Now, when we do the community well-being survey, one of the things that I didn't mention, of course, because I was just focusing on the older adults, we have lots of questions in there to get at exactly the kinds of things you're talking about. Things related to affordability, housing access, income, and so forth, ethnic origin, how long they've lived in the community, and so forth. Because we do have a mind's eye for those people that do want to explore some of those more specific questions about how groups that may be regarded as more vulnerable in their community, let's separate them out like I did with the older adults and see what's going on with them. And you're right, actually, that's the area where we've had the most interest, is asking about the availability of the data from our community surveys so people can explore some of those questions. Wood Buffalo in the new year, Fort McMurray, 95% of the people live there, but 25% of them are the transient oil workers. Who draw on the community services. The community wants to support them and help them, but they don't feel connected there, because when you ask them where's home, they say Corner Brook. I fly in for my 28 days and I go home for 28 days. Right? So and to their credit, they're really concerned about trying to serve that group as a unique enclave within the community. Surprisingly, perhaps, Fort McMurray is one of the most diverse communities in the country as well, because when the oil sands were really picking up, they attracted a lot of offshore workers. They liked it here, they were doing well, so they applied for permanent residency. And so there's such a huge mix. I was there in early November. You were walking down the street in Fort McMurray, and it struck me like, the multicultural downtown Toronto that you see. It's just the diversity of people there, and they're struggling with that as well, because it's seen as, northern Alberta, native population, and traditional Albertans. Well, no, it's much richer. Yes.
Kind of building on that issue, if you want to move the market, as it were, on a national scale, or national well-being, you really need to make progress in the big cities of Toronto, Montreal, Vancouver. What I'm wondering is whether you could take what you've done in Guelph, where you have those very sort of specific local indicators, and do that in a big, complex, messy city like Toronto, or whether you would need to do it on a smaller, sub-city scale.
It's a great question, one we struggle with. Actually, we were talking with Toronto last year, and there's some other things going on politically in the city.
Don't be mean.
And we didn't want to be identified as part of, dipping into the gravy boat, apparently. So, but those challenges were identified. And one of the things that I'd like to say, the proof will be in the application, but we did have a mind's eye in developing the survey. Is this question transferable? Would this work just as well in a community of 1,500 people as it would in 1.5 million people? And I'd like to think we've done a reasonable job of that. Now, Toronto, is unique by virtue of its size and complexity for the reasons that you identified. So, one of the things that I think that we would be able to do if I was, thinking big, is that the survey in and of itself could actually probably stand reasonably well. It's just that what we would probably do is tailor it very slightly to be a little bit more responsive geographically. So on questions like, do you make use of some of the arts and cultural facilities? We put examples in so people know what we're talking about, like this theater, this gallery, what have you. We might make that a little bit more locally, contextual. The other thing we recognize as well is the language issue. Is that, how many different versions and how many translations will we have to have? And, I'm sure you probably know that even no matter how carefully you do that, translating back, in my field in leisure studies, with a very large Chinese population, for example, some of our students who come from China study this because they don't have a word for leisure in China. We sort of implicitly understand what that means. There, it gets sort of translated into like joy. And so there's challenges in translation for things that we assume from our Western perspective would seem to be universal. But they have a number of other terms that describe the state of what we regard as the place, if you will, of leisure, or the activity of leisure. It's really quite interesting challenge, and that's just one example that would come up. Going back to the indicator level, the province of Quebec very often shows much lower levels of volunteering, which strikes us as odd because it's seen as a society that's somewhat more supportive and community-oriented around culture. And I have a colleague at the University of Quebec at Trois-Rivières, and he was saying, well, the explanation is simple. Volunteering doesn't translate well in Quebec because they have a term there that is called communautaire, and it's about serving your community. And volunteering has a somewhat more of a mandatory duty thing. So if you gave of your time to support your community by coaching a hockey team in your community, if I asked you, do you volunteer, you'd probably say no. That's not a duty, it's something that I do, it's my communautaire. So yeah, well anyway, I went off the rails a bit there, but the translation issue is a huge challenge. We even see it at the national level in patterns that we thought are comparable, but it shows up even in French English. We're still talking to Troy. Is there anything else?
Just one comment.
Sure.
As a son who runs campgrounds in provincial parks,
Right.
the weather has a huge impact. So for 3 years, it's been way down. This is in BC. Now it's gone up.
Right.
So your factor on the national parks may have been influenced by the collapse in the economy and the combination with weather. It's worth thinking about.
Parks Canada's response has been, you may have seen some of the ads. They now have Wi-Fi in backcountry areas because they think that people don't want to be disconnected from technology, and that's why they won't go to the national parks. So they're saying, no, we do provide that now. The second one, which is a little bit more interesting, and I have to admit, I'm not quite sure how I feel about this, is that with the changing multicultural character of our country, a lot of new Canadians don't have a cultural history connection to the natural environment. So for those of us that grew up here and we think of the wide expanses and our big national parks, the Rocky Mountains and so forth, there's this kind of visceral connection to it. And I think as kids, most of us would say that, yeah, we went camping, we went to the parks and so forth. It's not part of the lifestyles for a lot of new Canadians, and so as that changes, the proportion of Canadians that is part of their upbringing, essentially, they're losing that natural heritage connection. And so they're trying to introduce, by running like literally bus tours through the national parks with new Canadians to sort of show them what our heritage is all about. Anyway, thank you for inviting me, and it's a real pleasure to have a chance to tell you a little bit about what we're doing, so thanks.
Thank you very much.